There's a couple of theories in Olympic weightlifting as to how to teach. Some teach a top-down progression. You might want to write this down. Top-down progression or ground-up progression. There aren't too many people that teach the ground-up progression, so focus on the top-down progression. I use the top-down. I think there's many more good reasons for the top-down than the ground-up. So what does that mean? Well, top-down means we first have them hold the bar standing up. And we begin to teach them how to move from here, from the top, as opposed to having them get over the bar, find their position, and move the bar from the ground up. Okay? So it's sort of like teaching a golf swing where you just teach someone to chip first before you teach them how to swing a driver. Okay? And I think there's a little more sense in that than teaching them how to start with a driver. Although there's still a few people out there that do, and they do fine with their clients or wherever, but I think it's easier for us to work with the top-down progression. So I'd like to leave you with at least one thing that you guys can at least begin to use in the clinic tomorrow or on Monday. Okay, so if I can get you to just be able to look at a deadlift, understand some of the basics, and begin to show your clients how to do that, then I think I've at least accomplished one of the goals. You know, a lot of times you go to these talks and when do you ever apply what you learn? I'd like you to be able to take this and use it on Monday, okay? Especially the deadlift, because every client that comes in, just about every client that comes in, you can use the deadlift with, and you probably should, okay? So, there's a couple of things. First of all, you probably need a light bar. So there's body bars. Start with a 5-pound bar. Sometimes I'll just start with the stick to teach somebody how to just start to make a move. People have to learn two things when they grab a bar. They have to learn how to hold the bar, and they have to learn their squat stance, where their foot placement is going to be. Those two things are critical before anybody should be moving a weight in any fashion. So there's hand placement, how wide on the bar you go, but there's also how you hold the bar. And what I like to teach, and I teach it right off the bat, is what's called a hook grip when you grab an Olympic bar or a weight bar, which is thumb under your first two fingers. So I'm going to stand this way, and can you guys see how my thumb is under my fingers? There? That's a hook grip. A lot of people grab it this way, or they'll grab it this way, or they'll use what's called a reverse grip, where one hand goes one way and the other hand goes the other way, which a lot of deadlifters use. You'll never see that in Olympic lifting. In order for you to pick up and accelerate a weight that is quite heavy and not have it be ripped out of your hands, you have to have a hook grip. So for your athletes, when you begin to teach them deadlifting, don't use the reverse grip. That's good for deadlifting. But deadlifting is good, that's good for powerlifting. And powerlifting is good for nothing except if you want to be a powerlifter. I don't see much carryover from a powerlifting perspective to an athletic performance. Whereas with an Olympic lift, 100% carryover. I do Olympic lifts with golfers. Golf is really an explosive sport when you look at it. It's a controlled chaos, I call it. Because there's all kinds of things going, but it all happens in a perfectly timed situation. Same with the Olympic weightlifting. You've really got to have that timing down. So, we grab the bar. The first move that I'm going to teach someone, I'm going to try to get it sideways for you, is from here. We have to bend our knees and bend at the waist at the same time. Okay, so we have to synchronize this. So we've got a little bit of butt out as the knees go forward. So what I teach someone is there's 4 positions. There's mid-thigh, which is here. There's an above-knee position. There's a below-knee position. And then there's from the floor. So those are sort of checkpoints that if I can get someone to be able to get to the mid-thigh position, if I get 10 good reps out of them, I'll then let them go down to the above-knee position. I'll then let them go down to the below knee position, and when they get that, we can then let them go down to the floor, but I still won't have them start at the floor. I'll start at the top. That way we can really assess how they're doing, because getting the bar from below knee to above knee is the trick with this. That's the transition point where most people are going to fail. That's really the sport, is teaching someone how to get the weight from here to here, because then that's where you're going to blast away. And the timing of that has to be perfect. And you know, if that bar is out in front of them, you saw that big guy with the snap, if that bar is out in front of him by a quarter inch with 450 pounds over your head, it's coming down. You've got to have that perfectly balanced. And so they're throwing it up in the air and they're getting it in the exact spot over their head to catch it so that they can stand up with it. So there's a lot of timing. And that means that when he gets that bar just to the right, so we call it again the sweet spot. Well, he's a pro. He hits the sweet spot a lot, like pro golfers. You know, they hit those drives down the fairway often because they practice. But they say it takes 5 years to learn the lifts, and then it takes 5 years to see how much you can lift. Because it's that complicated. Now, just the deadlift alone to teach your clients or your patients, it's really not that complicated, but there's things we have to look at. So, when we make this move, we're going to keep our lumbar spine in neutral. And does everyone understand neutral? I mean, I think that's a term that we all have used and throw around. When I say neutral, it's a position that the spine is in. This is how I look at it. That the balance through the disc is even, and all the different structures in the front and the back of the spine are being used in proportion to the strengths that they have. So the muscles are firing to their level. The discs are engaged, but they're balanced because there's not too much force, there's not too much of an arch squeezing the disc forward, but it's not a flat spine where we're now creating a flexion moment in the spine and maybe squeezing that disc backward. So, I hear a lot of the personal trainers say, well, come on, let's bend over, get a flat spine. I don't think a flat spine is necessarily a neutral spine. Does anybody disagree with me on that? Anybody? There should be some. Now, sometimes I need an x-ray to understand somebody's neutral, because sometimes you've got a big L5-S1 extension going on, and then the next 4 vertebrae are straight. So, and that's important to know when you treat somebody, because extension might help the disc at L3, but it certainly isn't going to be great for the L5-S1 situation. I call that the paradoxical back, so you got to prioritize. Figure out, well, right now the disc is really the issue. And so what I'll do is I'll use my strap, and I'm going to have someone demonstrate shortly with that, and I'll block the L5-S1 so I'm not getting extension there, and I'll get extension above. Because I don't find I can use enough pressure with my hand to do that. So I came up with, it's a luggage strap I had on the top of my car. And I put it on the table, and it was perfect. It's about the size of a spinous process. It's perfect. So it really, you can get on whatever spine, looking at this and start working with this, how hard it is to do. Forget getting it off the floor. I mean, just to get it to the mid-thigh position. They're so uncoordinated and have such poor motor patterns. So am I going to have a guy doing deadlifts before he can do this? No. If he can't do this, he's not taking it off the floor. Yeah.
Can you just comment, is it always pain-free if they're doing it properly? Or do you find people who've been doing it wrong will have symptoms when you try to correct them? Or should they not do it at all if there's pain?
Yeah, no, don't forget, we're talking about symptom-free people. You know,
Okay.
Will I do deadlifts with my disc patients? Absolutely.
Okay.
Absolutely. When they're pain-free and they can tolerate it.
So that's the
Oh,
prerequisite.
yeah.
Totally pain-free.
Yeah, I'm talking, here I'm talking about the health.
Okay.
But you're right, and I'm glad you brought me back to the PT side of this. And absolutely. You don't want someone having symptom production when they're doing this. I really feel it in my back. And I go, okay. So my comment to them is it strainful or painful? Well, does it reproduce? No, but I feel it like it's working. You know, it's like, I'm tired. Okay, so strain? Yeah, it's kind of, my back's really working hard. I go, I bet it is. Because how many people haven't engaged their lumbar spine in too many activities in their lives? A lot. And you're going to run into that. I've had people where, you know, the little bar, you know, they do 10 of those and they're like, man, my back is shot. Because you finally got them connected. and it's tired. You work it, you don't overwork it. It's applying the right load at the right time, which is what PTs are supposed to know how to do. Isn't that what we're taught in school? Isn't that what our profession is about? To get someone better, we don't overload them, we don't underload them. But I think a lot of times we underload them, or we're not putting them in the right positions with these bending over things sometimes. Or putting them in a position where they could accept more weight and then get better. You know, the thing about Olympic weightlifting that's different than powerlifting is that there's speed involved. That means acceleration. And I think when I see patients that have come to me after having an ACL 2 years ago, and the kid's a football player, says, Rick, I can squat 400 pounds. So, okay, show me. He puts the bar, and he's got 400 pounds on his back. But that's not a squat. I don't know what you call that. I don't call that a squat. You call it a bend, call it a mini something. A squat, you get all the way to the floor, and you're standing up. Otherwise, it's not a squat. So anyway, that's what I said to him. I said, well, I put 100 pounds on the floor. I said, okay, go to the floor. Couldn't go. So I took the weight up and put the bar in his back, 45-pound bar. Go to the floor. Couldn't go. I said, if you could do a full squat from the floor up with 150 pounds, you'll be stronger on the football field than the 450-pound thing you're doing, whatever you want to call it right now. And you'll be safer because you're strengthening yourself at the end, at more end ranges, in positions where you might end up on a football field. And he was a lineman, so he's coming off the, he's coming out of the line. He's got more than 90 degrees of flexion in his knee. And what's the old adage? Old stuff. If you strengthen above and below an angle, that angle gets stronger, right? So if you do an isometric strengthen above a particular angle and below, it'll make the angle in between stronger, correct? So if we need our guy who's going to be probably in a little bit deeper position than a 90-degree position coming out off the line, wouldn't we want to strengthen below and above? Well, the deep squat. What about the posterior cartilage? You're putting a lot of pressure on those. I don't like those deep squats, the docs say. It's very bad for the knee and the femoral pressure. It's too great when you're doing that. I said, no. It's appropriate pressure. The knee's designed for it. Do you hear the announcers on ESPN when they're announcing the ball game say, geez, there's that catcher's out again, but in that deep squat, another posterior horn tear in his cartilage. I've never heard that. They're in a deep squat their whole life. Go to India or China or whatever it is, they sit in a deep squat for crying out loud. That's how they eat food. They're not having knee replacements. They don't have cartilage surgery. So, I don't buy it, is what I'm saying. I train athletes that do it all the time. They don't have knee problems. Olympic lifters, in the Olympics, the Olympic lifters are the second least injured athletes in the whole group of the Summer Olympics. You probably didn't figure that, right? And they're the second most flexible. Who's better than them? The gymnasts. But they're more flexible than the track and field guys. Because when you saw that guy get in all those positions, he gets in extreme ranges in all those positions. He's got great hip flexibility. Now, that guy's like 290 pounds. He's got great hip flexibility. He's got great spinal mobility. He's got great shoulder flexibility. Is he working at some end ranges? Well, at his level, and he's pushing his body, yes, but he's not blowing out his knee. These guys don't get knee problems. They got the most stable knees on the planet. They don't have ACL. There's no ACL injury. I do the Olympic lifts with ACL pain. If a doctor can put the screw at the point of isometricity correctly, then why can't you do a full squat? The knee's designed to bend that whole full range of motion, right? Sure. I don't have a problem. Now, there's the whole legal thing. If a doctor says you can't do it, you can't do it. So you can't do it. Sorry. And I'm not going to, if a doc says don't do it, well, I'm not doing it. That's where we get caught. I can tell them I don't agree with them, and they'll never send me another patient again, so you got to watch out. Which is why I'm not in insurances anymore. So people come to see me because I don't have to deal with that. But we've got to look at those positions and understand that. I had a doc accuse one of my friends who's a personal trainer. He was doing a gentle leg pull as a stretch. You know, just a little leg pull, one on each side. The doc says, oh, you tore her labrum. And now the client wants to sue my friend. I'm like, doc, where do you get off saying? Where do these guys get off saying this stuff? First of all, call the guy and say, what are you doing? You know, what happened? And when he explained away, there's no way you tore a labrum for crying out loud. That's the most ridiculous, but sometimes these docs, they just, you know, they want to be the man. They want to say, and I don't like that particular doctor. I got to tell you, that is another one that's kind of got under my skin. So you know, unfortunately, we have to legally, we've got to do these things, and we have to follow the law. And I'm not saying to ever, you know, not listen to the doctor. Unfortunately, I mean, or maybe at some point we can change our profession so that we don't have to do that. I don't go into his surgical, the OR there and say, Doc, you missed the stitch to go over here, you know. I've never done that. But then we got Doc walking in my place telling me I'm not doing a squat right. We should be the guys that are the experts in exercise, right? That's what we're being taught to do. But there's a whole body of knowledge in the whole strength and conditioning world, in the Olympic weightlifting world, that I think we're missing. For whatever reason, we haven't taken a step in that direction, and we think we need to. So let me get back to doing it. I get off my soapbox here. Anyway, so let's take a move from the floor. We'll do a deadlift. We have to get the setup right. Let's see if I can do this without getting blinded. So, foot placement, critical. We want our heels under our hips, feet slightly turned out. Feet should not be pointing straight ahead.
Does that help you?
Yeah, that's really handy. Oh, okay. An example of orthometrics that I use. I measure everyone's tibial torsion and hip anti and retroversion as a part of the biomechanical evaluation. Why? I always wondered why we were told to do that. That's great to know. Are we going to change it? We're not changing that stuff. But what I use it for, because I wondered, why do you do that? Well, now I know when someone's got a significant torsion in one foot or both, that when I set them up to do a squat, well, maybe that right foot might need to be turned out a little bit more in order for it to be in what I call lower extremity neutral. Or maybe because of that hip anteversion, I know that knee might just be a little bit inside of where it should be, because that's where everything's as neutral as we can make it. And do I get some people that just shouldn't be doing squats because of their bone? Absolutely. Now, if they're CrossFitters and they want to do it, well, then I got to try to find as good of a happy medium as I can, because I know they're going to want to do that, and I do. So we try to play with that. But I want to know those numbers so that I know what's happening. And the funny thing is, once you start working with people, they'll find their comfort zone a lot of times. But there's a few that you're going to have to help. So knowing those numbers is helpful. So we want to always have the feet slightly turned out. Heels just about under hips, maybe a little bit wider, depending on their somatometrics. You know, once we start moving, we've got to look at that stuff. So we get up to the bar, we get our feet in the right place, and then we find our hand position, which is going to be, the knees should be just brushing the insides of the forearms when we're at the floor or the pull position. So we get down in here. We want to make sure that our head and chest are up and engaged. Let me go sideways so you can see. Because one of the most important things about understanding the somatometrics and dealing with figuring out biometricity is trunk angle. Because every person is going to have it's just like a signature golf swing. Everyone has the correct trunk angle in order to pull the weight off the floor. So when you look, because once you've determined what the correct trunk angle is, you're going to be looking at that trunk angle throughout the entire first pull. Because what you want to make sure is that they maintain that trunk angle as they rise off the floor. So we want to get in here, we find our grip. For the athletes, I teach them the hook. For little Miss Betty, the 80-year-old, no, I'm not teaching her hook grip. She's got knobby thumbs and it hurts. So we don't do the hook grip. So we get in here, we find our position, and based on where their center of gravity hits, so we get in here, we find our position, and based on where their center of gravity hits the floor is how I know when someone's in the point of biometricity. So what I'm looking for off the floor is I want all the centers of gravity lined up right under the knot of the shoe. at what I call the junction of the heel arch. You're not in your heels, you're not even in your arch, you're not, certainly not on the balls of your feet. You're just behind the center, it's like 40% from the back of the foot, right under the knot of the shoe, off the floor. Now, in Olympic weightlifting, as the weight comes up and as you tuck the bar in, you tend to get into your heels a little bit before you get into your triple extension position. So there's a little shift of the weight backwards in order to throw the bar up in the air. But off of the floor, I want them right here. So now, the motion, head up, arch back. We're maintaining a nice trunk position coming off the floor. Once you get them to be able to do that, then once the bar's over the knees, the move is hips to the bar. Okay? And those are the verbal cues I use, hips to the bar. So I'll say, and what you're going to see a lot is this. First of all, they're going to be round, and they're going to go. I call that the butt head. Because the butt's rising before the head. And I have a lot of butt heads in my gym, unfortunately. So if this is the head and this is the butt, if when they go to make that initial move, either they lose lumbar or butt rises first, I call that death move number one. You tell them to put it down. You fix that. You've got to get, and I've got mirrors all over the place. You've got to get them to be able to see the front and side mirrors so that they realize what they're doing. Because a lot of people, they don't know what that feels like. Some people's kinesthetic awareness is horrible, which is why they're probably injured. But you've really got to focus with them in having them be in that position coming off the floor. When you have weak quads, you pick up boxes like this. Your legs stabilize while your back does the motion. The exact opposite of the way I want to pick up a box. You want your spine stabilized while your legs do the motion. Right? Isn't that what we teach? And remember, a straight spine is not a good spine. And when you go to pick up a box or you go to pick up anything with a back patient, the spine is not supposed to be upright. When you do a squat, the spine is never upright. It's in neutral. And as you bend, it gets somewhere around a 45-degree angle. So the trunk angle is going to be somewhere, depending on your somatometry, somewhere, could be 40, could be 50, 45. It's certainly not going to be 90 or parallel, and it should never be upright. How can you get to an object that's in front of you if you try, you got to go up on your toe? I see all handouts of how to pick up things correctly from physical therapists, and the spine is perfectly straight, like it's sliding on a wall. That's impossible. You can't do that. I wouldn't teach a squat that way. So, try not to do that. And one nice visual for you as a teacher and for the student is what I call the triangle position. When the bar is at the knee, can you see the triangle my body is creating? Straight, this is the base, and then we have this and this. That's another nice little teaching tool that people can, oh no, I'm behind, oh, there it is. And when they find the triangle, guess where the weight is in their feet? Right under the knot of the shoe. So that's a nice little teaching tool. And so what are some of the faults from the frontal plane? A lot of times you're going to see people, they do this, internal rotation adduction. So what do we do to fix that? Get them to, I always say the feet dictate the corridor that your knees are going to follow. So turn your feet out once I figure out what their stance is, and then knowing what their hip retroversion is, whether that knee is going to follow it exactly or maybe be a little inside of it, so that we get them following the corridor of the feet. So we solve that. So does that mean we need an orthotic? Maybe. That's part of the whole slop, where we get that significant loss of power, where we have movement that is not helpful to the direction we're moving in. Like a reverse C in golf. When you see a golfer go like this, and his upper body's going that way, when the ball's supposed to be going that way. That's some serious slop, okay? And slop means, and I guess I didn't want to talk about that slide when it was on there. I got on the soapbox there, sorry. But anyway, so if you're creating slop, that's when you start to create injury. You're putting stresses in the joints now, into ligaments. You're getting into stressful places when you have slop. Just like this. If you're going to push and your knees go inward when you push, Well, if you're trying to go upward and your knees are going inward, do we have forces going in the wrong direction? As soon as we have those, we're creating problems that could potentially be injurious. We're certainly taking away from the power that we're generating, because now some force is being dissipated in a different plane, not in the plane we're moving in. And that can be injurious, and it's certainly going to take away from your power. So we don't want that. So we want to be solid here, straight up, and then we bring our hips to the bar. So we get our feet in the right position. Another thing that people are going to do is they're going to stand through they're going to pick up with their trunk instead of push up through their legs. And I see that a lot, because people don't know. First of all, people's quads are weak, so they want to use their glutes and their hammies. And people don't know that motor pattern, because they want to pick something up, so they want to pick it up. Here, you want them pushing themselves up. At least, certainly, through here. Now, once the bar is in the right position, we fire our hips to the bar to stand up, to finish that position. Monday, what are you going to tell this person to do?
Lumbar spine.
Lumbar was not arched. That's one thing. Yep.
Turned up.
There we go. The first thing I'm seeing is his foot. I know he's tired now. Wow. The reason his lumbar spine is not in the right spot is because he is not at the right trunk angle. So first of all, we got to fix our trunk angle. Chest up. Now that's hard, isn't it? I'm really making you work. Now he's giving me extension here, but he's not giving me extension where I want it. So we got to be careful with this guy. So I'm not going to ask you to pick that up until we get that better. But I would probably start him up here. I would do my top-down progression. So let's just do that.
Top?
Yeah, pick it up. Easy. Find your hand placement. And always make sure you're equidistant from the center. So for you, I would go a full thumb's distance from that smooth thing. All right. Now just make, go to the mid, when your feet are a little too wide. Turn them out. There you go. Are those Ted shoes?
Who's?
Ted shoes?
No.
They look like Ted shoes. Let me see you make the move. And stand up. So if that's your person on Monday, what would you tell them to do differently? Anyone?
Initiate the movement with their hips.
More so. I mean, you want to initiate with knees and hips, but he was very upright. There was no trunk angle. And at the bottom, and when, you have to, and what you're going to find is some people, when they bend, they create too much trunk angle. You only need to create enough trunk angle to clear your knees. So someone who's got a long femur is going to need a little more trunk angle. Someone who's got a shorter femur can be a little more upright. And those short femur people are good at a little bit weightlifting. It's a little easier. So you only, and once you clear the knee, all you do is bend your knee. There's no more trunk angling wherever it comes from. So, but we still need to get over the bar, to get the bar over the knees. And the bar always hangs from your arms as ropes. We don't hold the weight with our hands. We let them hang. So go ahead and try that again. A little more butt out as you initiate, while you bend your knees. See you bend your knees now. Knees, hips together, a little more out. Go. There we go. And the bar should stay. And some drills, I just have them slide the bar down their thighs and then come back up to stay in contact. So I would like this. Straight with the knees.
Up.
Down a little lower. Now go to above knee. All right, so your weight's still too much in your heels, so let's get you over. And let's get you over. There we go. Now go below knee. See how he had to manipulate the bar to get over his knees? Why? Maybe his legs are too long? No.
Not enough trunk angle.
Not enough trunk angle. He didn't get over it enough. So this is what you're going to be working with. You got to be having these cues. You got to see this stuff. Get over the bar more and go below your knee. See how he sat back in his heels? Is he in his biometric points? No, his weight's at his heels. It's not in his under the knot of his shoe. So let's get you. Try that again. Stick your butt out more. Arch and get over the bar. Go ahead. Right there. Now the weight's right where I want it. That looks good. Chest up. We're going to work on that. He's weak in here. We found that on the table. Maybe we just made him too tired. I don't know. And is that the triangle position? Son of a gun. And although I would say your weight needs to be a tiny bit forward. Right there. Bingo. Now we got it. Okay, stand up. Thank you very much. A lot of times you're not going to get somebody down to the floor just because it takes a while to get them there. But eventually with your athletes, you need to teach them how to get off the floor because in order to do it, you have got to be able to show them how to take it off the floor. Come up, catch it in a full squat, and then stand up. And the elbows have got to be pointing at whatever they're pointing at so that they can then dip and drive directly into the bar. So you need to be able to get them in those. So the deadlift of them all four is the one that you got to teach the first. From the deadlift, a lot of good things are learned and a lot of good things happen. Now, I think my time is up. I would love to open the floor up to any questions, but I want to thank you guys so much for listening to me. I know it's not easy, and I apologize for going on about a couple of different things, but I'm hoping that